I want to follow up on Senator Collins' comment. In Maine, the description she gave of the rural capacity in Alaska is more severe, and I want to first ask some comments or question to you regarding the tribal agreements that we've done in a program that I've worked aggressively with you all, and I think it's creating some success, and I want to just get a sense from you. I know in Alaska, when we worked with the VA and Indian Health Services to try to utilize and maximize these great resources we have, Secretary Shinseki, you were in Alaska and you saw firsthand some of our veterans who just needed care and they didn't want to travel literally at some cost of $2,000 in airfare or a day and a half to get just basic care. So the agreements you've all worked out regarding Indian Health Services in Alaska, which I think has been successful. I think we've already capped out at or done over $2 million in reimbursement. So now veterans, native and non-native, can go and access these facilities and get health care right next to their home, but still have choice, that they can still go to the clinic and the hospital, which is very important to VA. So I want to first commend you for this work, and I'm hearing good news on it. There are always bugs to work out, and where I know you guys are working on that with our Indian Health Service folks, but we're seeing great impact because it's all federal money anyway, and these veterans deserve the care no matter how remote it is. But I want to ask you, do you see this, and are you now looking at a longer-term expansion in other areas such as other Indian reservations or other places within the lower 48? I can tell you the response has been very good. I was up in the Arctic about a week and a half ago, met with some veterans, and there is no question in their mind that the access to health care has greatly increased, and they get better choice now, and the VA basically reimburses Indian Health Services for those costs that they qualify for. So can you give me some thought? And again, I want to thank you for working with me on this project.
Senator, I'm going to call on Dr. Petzel, who has the details here, but our approach to this has been to provide our veterans, whether they're rural, highly rural, remote, Native American, the same access that we try to provide to veterans in urban areas where they have more choices. So a lot of good work done here by the Healthcare Administration. We want, ideally, veterans to be able to walk in and have that access to health care and let us figure out what the payment streams are. You know, we can sort that out.
Right.
And that's what Dr. Petzel does for us.
Great. Dr. Prezzo?
Just to give a few of the details, Senator Begich, the Secretary is absolutely right. We are committed to providing a high level of access to both primary and specialty care in remote areas. And Maine, as we saw earlier, and Alaska are two of the many excellent examples of how I think we're having some success in doing that. In the Care Closer to Home program in Alaska, there last year were about 900 people who normally would have traveled down to Seattle or to Portland for care, who were delivered care in the community. We spent about $10 million on oncology care there and over $23 million in specialty care services with the private community as well as the Indian Health Service. And I want to highlight what has happened with the VA, between the VA and the tribal organizations in Alaska. There are 26 tribes. We have agreements and memorandum of understanding with all 26 of these tribes where we share services, number one. They have specialty services available, as an example, in Anchorage that we don't have, and we now buy those services for veterans in the Native community. In addition to that,
And it's high-quality care.
Excellent care. The South Central Foundation, which is the organization that runs the healthcare system there, is, by Don Berwick's estimate, the best healthcare system in the United States.
Fantastic.
It's excellent care. In addition to that, though, with the other MOU that we have with the IHS and tribes, we are able to pay for veteran care in Native installations by the IHS or by the tribes. We're able to reimburse them for the care. And this year we're expecting in 2014 to spend about $36 million around the country doing that, and even more in FY15. We've got arrangements with basically all of the IHS facilities in the United States and about 81 tribal entities right now, and we're expecting another 75 tribal entities to be signed up with us before the end of 2014. Very successful from our point of view.